What's up, guys? Study Times here. In this video, we're going to talk about diabetes type 1. If you like the video, don't forget to subscribe to our channel and turn on the notification bell so you don't miss any of our uploads. Let's dig into it. So, first of all, what is diabetes? Diabetes type 1 is a chronic disease, so it happens in a long time and it's a metabolic disease. What happens is the pancreatic beta cells are getting destroyed, and because they are not there anymore, they cannot produce insulin. So the body is in insulin deficiency, and that makes the glucose build up in the body in the blood, and they don't enter the cells. So that makes the hyperglycemia. So, what is the meaning of diabetes? Diabetes means going through, and mellitus means honey or sweet. When the insulin is lower, so the glucose cannot enter the cells, and that makes the hyperglycemia means higher amount of glucose. Anemia means blood, so the higher amount of glucose in the blood. So because the glucose is not in the cells anymore, so the cells basically starve because the glucose is used to produce energy, and because they don't have any glucose anymore, so they are starving. That makes your body to feel extreme hungry and weakness. So you have a polyphagia, which means extreme hunger, and fatigue is weakness. And glucose, because the glucose is a lot in your blood, so the glucose level exceeds the renal threshold. In a normal person, there is no glucose in the urine, but when the amount of glucose is a lot, so some of that glucose enters the urine in the kidneys. So that makes the blood to have glycosuria, means glucose or sugar in the urine. Urea means in the urine. So that makes the osmotic diuresis. What it means, osmotic diuresis, this is the definition: increased urination due to the presence of certain substances in the fluid filtered by the kidneys. So in this thing, we have the glucose, which is the certain substance. So the glucose enters the urine and makes it a higher osmotic, the higher osmotic fluid, and that makes the water goes to the urine more, and that makes to produce more urine. So you have polyuria, it means a lot of urine production. And because you lose a lot of water, so it's the body goes through hypovolemia. Because we have a lot of glucose in the serum, so that makes the osmolality of the serum higher. And because we lose a lot of water into the urine, so the body goes through polydipsia, which means excessive thirst. Another thing that happens is endothelial glycosylation, means the endothelial cells are getting damaged because a lot of glucose, they are transporting a lot of glucose because a lot of glucose is in the blood. So they are transporting a lot of glucose across the blood vessel, and that makes the endothelial cells to undergo glycosylation, which means the glucose or carbohydrate is covalently attached to the macromolecules like proteins and lipids. So that destroys the endothelial cells. And when this happens, we have microvascular damages, and that it accelerates atherosclerosis in large vessels. Another thing that happens is that higher glucose level actually reduces the level of the vasodilator nitric oxide. Nitric oxide, or NO, is a vasodilator, and the glucose reduces the amount of nitric oxide in the blood, and that makes the a narrowing of vascular lumens, and that lead to tissue ischemia, which means lower amount of oxygen to the tissues. So that makes the cells to die actually. And because the blood supply to nerves is getting less, so we it's going to happen that segmental demyelination. So the nerves are losing the myelin sheets around them, and that makes the nerves to slow down the conduction, and that leads to neuropathy, means the diseases about the neurons. We have different types of diabetes type 1, type 1A, 1B, and latent one. So in type 1A, it's immune-mediated diabetes. So it's the autoimmune destruction of pancreatic beta cells, which produce the insulin. So the body attacks the beta cells. So it's an autoimmune destruction, and it's the most common one. It's a type 1 4 hypersensitivity response. What is type 4 hypersensitivity? It's when the hypersensitivity is due to the it's cell mediated, not humoral. Another type is type 1B. It's idiopathic diabetes, so it means we don't know why the reason is not, we don't know the reason. So there is no evidence of autoimmunity, and we have different degrees of low insulin, and the patient undergoes episodes of ketoacidosis. Latent autoimmune diabetes is progressive form of autoimmune diabetes, and the onset is the after 30 years old. The risk factors is genetic actually. Type 1 diabetic is genetic mostly, and you can see different genes that can happen in multiple gene polymorphisms. So it's not that important, but if you know it, it's better. What are the complications? When the blood flow is getting less, so the white blood cells cannot reach the organs. So there's a higher risk of infection and a delayed wound healing and higher risk of amputation. The patient has a diabetic ketoacidosis. So what it means is like when the glucose in the blood is higher than 250 milligrams per deciliter, the body has ketone body. Because the glucose cannot enter the cells, so the liver produces ketone bodies for the energy production in the other cells. So we have ketone bodies in the blood. So we have ketonemia and metabolic acidosis because the ketone bodies are acidic. We can have neuropathy, which means diseases related to the neurons. The neurons can be in the autonomic system or somatic system. We can have microvascular diseases, right? Like retinopathy, nephropathy. Pathy means disease, so retinopathy means diseases related to retina, and nephropathy is diseases related to the nephrons, and the patient can have erectile dysfunction. About macrovascular, so it can be cardiovascular diseases, cerebrovascular diseases, and peripheral vascular diseases. And if you didn't know, cerebrovascular disease, there are diseases related to the blood vessels and the blood flow into the brain. What are the signs and symptoms? The classic presentation it has three P's, so polyuria, polydipsia, and polyphagia. So three P's. You can memorize it. And because there is dehydration, the mucous membranes are getting dry, so the skin turgor is decreased. So what it means, when we have decreased skin turgor, when you elevate the skin, as you can see here, it just when you pull it up, it just stays there. So it stays elevated. But in a normal, as you can see here, but in a normal person, it just comes back to its first position. And the patient doesn't have any energy, so they have fatigue and blurred vision and gastroparesis, which is the weak muscular contractions of the stomach. So the patient can have constipation and paresthesia And because they don't have any energy and the glucose doesn't enter the cells, they can lose weight. So the body is using fat instead of the glucose. And in mild hyperglycemia, the patient can have no symptoms, but when it's moderate to severe hyperglycemia, so the volume can be depleted. And because they don't have any water and they are dehydrated, the mucous membranes are dry. And so because there is no water in the blood, so they have hypotension, means lower blood pressure, and the skin turgor is a low. So diagnosis. In diagnosis, we have lab results. In a non-fasting or random glucose test, the glucose is around 200 milligrams per deciliter or higher. In a fasting glucose test, in a pre-diabetic patient is between 110 to 125, and in diabetes is more than 126. There's another test, the hemoglobin test, hemoglobin A1C glycated hemoglobin test. What is it? When we have glucose in the blood and it's so high, the glucose is getting attached to hemoglobin. And that hemoglobin is called hemoglobin A1C. And it shows you the amount of glucose during the past 3 months. Because the glucose sticks to the hemoglobin for as long as the red blood cells are alive. So during the lifespan of the red blood cell, the glucose is stick to hemoglobin. And the red blood cells are alive for almost 3 months. So basically, the hemoglobin A1C tells you the amount of glucose during the past 3 months. So in pre-diabetes person is between 5.7 till 6.4%, and in diabetes is more than 6.5%. And we have a urine analysis, albuminuria, it means, or proteinuria, it means proteins in the urine, and glycosuria, it means glucose in the urine. So you can have glucose in the urine, and because the blood vessels are getting damaged, so the albumin or proteins can enter the urine as well. So you can have albuminuria as well. How can we distinguish between type 1 and type 2 diabetes? Type 1 it's an autoimmune disease, so the body produces autoantibodies against the beta cells. Another way we can distinguish between these two is when the body is producing insulin. This is the way it produces it. We have pre-proinsulin, which has a B chain, C peptide, and A chain, and it produces proinsulin, and the proinsulin converts to insulin and C-peptide. So these two are attached to each other, B chain and A chain. They get attached to each other and they produce insulin, and they produce C-peptide separately. So when the amount of C-peptide in the blood is higher, it means the blood is producing insulin. But when the amount of C-peptide is low, so it means the body doesn't produce insulin. So the production of insulin is lower. So in type 1, because it's about production of insulin, so the C-peptide is lower. But in type 2, it's a different story. So other diagnostics, we have physical examination as well. So one of the examination is fundoscopic exam, which means they are looking at the retina of the patient. You can see cotton wool spots like here, 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 and flare hemorrhages. So you can hemorrhages here and there. And there is another test called monofilament testing. There is a filament. They are testing the sensation of some parts of the body. So they put some filament on your feet, and you should tell the doctor if you feel it or not. So in diabetic person, the sensation is lower. And the lower extremities, so you have lower pulses in the feet, and you can have presence of ulcers. What is the treatment? The patient should use insulin in their whole life. So you can have short-acting insulin or insulin pump, which is pumping insulin continuously into the blood. That's gonna be it for today. See you in the next one. Bye.